Let's talk about pelvic floor flares. Now, when my symptoms began when I was 13 years old, everybody thought I had a bladder infection, but my cultures always came back negative. But there was one other really interesting clue, and that is that I had a very, very narrow urethra. It was like trying to pee through a needle, and it was painful. And my doctor used to do what they call a urethral dilation. They basically stuck a piece of metal up there and stretched it. Not fun. Not fun for a teenager, that's for sure. Now we ask the question, gee, why is her urethra so tight? And the answer comes to muscles. My symptoms began after I broke my tailbone when I was 13 years old. And when I broke my tailbone, I injured my muscles. My muscles got tight, they squeezed my urethra, bam. Urinary symptoms. Now, pelvic floor flares happen when you have injured muscle. And the challenge of it is that you do your physical therapy, you're working hard, you get your muscles healthy again, your symptoms go away for maybe a short or even a long period of time, and then bam, you do something and you hurt them again. And you have the flare comes back. And that brings back a lot of worry. Oh my God, my IC's back. What's wrong? When in actuality, it's really rather simple. It's an injury to muscles. And muscles can be hurt routinely. And they are often hurt by today's modern life. Whether you're sitting at work for long periods of time, or whether you're driving in a car for a long period of time, or whether you're enduring prolonged stress, all of those can tweak your pelvic floor. So let's talk about how we handle these types of flares. Now, it's important that you understand that the pelvic floor muscles are at the base and the sides of the pelvis, and they hold structures in place. But they're also skeletal muscles. These are muscles that help you move your body, like open and you close your legs. But what makes these muscles very, very unique is that they have holes in them. For men, they have a hole for the urethra and for the rectum. For a woman, they have 3 holes. They got a hole for the urethra, the vagina, and the rectum. But in and around those structures are muscles. So what happens when the muscles get tight? Oh, they squeeze them. The urethra gets squeezed, that's making it hard to start your urination. The vagina gets squeezed, which means that sex might be quite painful. And the rectum can get squeezed, which means that these patients are going to start having some problems having bowel movements and struggle with recurring constipation. Now, my typical flare, my worst pelvic floor flares are almost always associated with driving to the airport. For me to take a flight anywhere, I have to take a bus to San Francisco International. It's a 2-hour bus ride, very, very bumpy. Every single time I've taken that ride, I have arrived at the airport with my pelvic floor spasming. And thus, I always pre-medicate with a muscle relaxant to make that journey easier, and it helps tremendously. Now, one other thing. If you have pelvic floor dysfunction, the odds are, hopefully, you're working with a physical therapist, and maybe that physical therapist is teaching you how to do your own internal work. The structure of muscles is fascinating because a healthy muscle feels like a raw chicken breast. It's soft, but it has substance. A tight muscle feels like a cooked chicken breast. It's rubbery. It's stiff. And a badly damaged muscle feels like beef jerky. It literally is so stiff it can't move. And so when you're doing your internal massage and your internal work, you really begin to learn what healthy versus unhealthy muscle feels like. So talk to your physical therapist about that. Let's go through the basics here. What are the triggers for a pelvic floor flare? Falling and stumbling, sports injuries, and please, I gotta tell you, we have had so many phone calls in the last year from patients who hurt themselves weightlifting. I guess it's a new trend to lift very, very heavy weights, and God forbid you hold your breath and you're lifting a heavy weight. You're actually putting a tremendous amount of stress on your pelvic floor, and you're potentially creating a hernia and other things. So again, I've worked with many patients recently whose symptoms began while weightlifting. But spinning, sitting on a bicycle for a long period of time, that puts pressure directly on the pelvic floor. Playing football, gymnastics where you fall a lot, ice skating where you fall a lot, ice hockey where you fall a lot, or sports which generally impact the pelvic floor can certainly injure them and trigger a flare. And even ballet, beautiful ballet, ballerinas are taught to tuck their pelvic floor unnaturally, and that can create long-term stress and tension. Another trigger is sitting for a long period of time, because sitting compresses the muscle. It squeezes it, presses it down, but it also compresses blood vessels, and it also compresses nerves. If you have a history of sciatica or pudendal neuralgia, that's an example of a muscle squeezing a nerve, and it hurts. That's sharp, brutal pain. Traveling can be a flare. Sex can trigger a flare. And of course, stress, especially prolonged stress, can trigger a flare, because when you're in fight or flight, your body is preparing you to fight for your life or run for your life. Part of that involves keeping muscles quite tight. Now, what do we do when we have a pelvic floor flare? Well, literally the first thing you can do is just get up and move. When you move and you do gentle exercise, this releases accumulated stress in your muscles, and it improves circulation. So if it's not painful, take a walk around your house, go outside, get in your garden, walk in your neighborhood. Just get up and move and help your body start to produce natural painkillers known as endorphins. The human body is not designed to be stationary. Movement is vital to our health, so try to move. Number 2, you can do heat therapy. Heat relaxes muscle, but some people crave cold. The people who crave cold often are people who have muscle squeezing nerves. Nerves seem to calm irritated nerves, while heat seems to relax tight muscles. So you can do a heating pad. The IC Network has a great triangular heating pad, perfect shape for the pelvis. But we also have these really good body heat heating pads, little square heating pads that you can attach to your underwear and wear for 8 hours. They will produce heat for 8 hours. Perfect for traveling. I don't go on any trip without wearing one of our body heat heating pads. And of course, you can use some of the over-the-counter oral analgesics like ibuprofen and or acetaminophen. Now, the next thing you have to do is you got to get serious about your muscle tension, my friends. And the way you do that is with stretching. So there are a number of stretches that will directly relax the pelvic floor. And I have a guide to those over on the IC Network. It's a free download that will walk you through all of the stretches that you can do to relax your pelvic floor. My favorite is called the garland, and this is basically where you squat down and you put your butt on your ankles with your hands up. And that directly puts the pelvic floor exactly where it's supposed to be. So if you're starting to feel a flare, you're at the bank, drop your car keys, drop them on the floor, squat down, pick them up, and just hang for a couple of seconds if you can. And that puts those muscles back into position where they need to be. You can do happy baby. You can do the cobbler pose. You can do a forward bend. Warrior 2. You can do the cobra pose. And again, you can find all of those over on the IC Network website. The next thing we want you to do after you do your stretching is we've got to do some deep breathing. One of the best ways to reduce muscle tension, stress, and anxiety is simple deep breathing. Most patients take short, shallow breaths in their chest, and that's not good. Our goal is to relax and release with longer, slower belly breaths. Why? Because when you inhale properly, you relax and release your pelvic floor muscles. So make deep breathing a regular part of your daily routine. So find a comfortable spot, preferably on your bed or on the floor in a comfy chair. Place your hand on your one hand on your belly, one hand on your chest, and as you breathe in, feel your belly rise. And then as you breathe out, feel your belly lower. The hand on your belly should move more than the hand on your chest. So inhale slowly in and out. Deep breathing is central to pelvic floor relaxation. Now, there are a lot of variations you can use. You can do box breathing where you inhale for 4 seconds, hold for 4 seconds, exhale for 4 and hold. Or you can do 5-5-5. But one of the favorite methods is actually the 4-7-8 approach, where you inhale for 4, hold for 7, expand for 8. This was created by Dr. Andrew Weil, and it's a breathing exercise designed to promote relaxation, reduce anxiety, and help with sleep because it activates the parasympathetic nervous system. So let's do it. We're going to go in for 4, hold for 7, and out for 8. Okay, the other thing you can do is you can do what we call pursed lip breathing. So interesting the way the brain and our body responds to the way we breathe. So with this, you inhale through your nose, but you exhale through your lips. So, and then we do it again. Okay, so hopefully you've dived into some good deep breathing and some good stretching. But if your symptoms aren't responding, we got to try some new things. So over on the IC network, we have a bunch. We have got 4 free guided relaxations in our self-help section. These were created by Corewell Health in Royal Oak, Michigan. They have been studied extensively with patients with pelvic floor tension and pain, and they work, my friends. So we've got a free audio series of Let Go relaxation specifically for pelvic pain and IC, breathe relaxation for pelvic pain and IC. We have a rest and relax, and we have a soothing shore. Another thing you could do is a muscle relaxant. It's quite common for patients with chronically tight pelvic floor muscles to use a skeletal muscle relaxant during flares. Baclofen is generally preferred because it is non-sedating and can be used while driving and working. Diazepam, also known as Valium, and cyclobenzaprine, known as Flexeril, are also popular, but they have a sedative effect. Thus, they are generally used only at night. You should not use them and try to drive. But a great option during a pelvic floor flare is actually a Valium suppository, where you can put the medication directly into your rectum or directly into your vagina to release that muscle tension in that area. Those are quite popular. Another trend that we're starting to see is some CBD suppositories from hemp and or medical marijuana. And of course, this is where your hands matter. Hopefully your physical therapist has taught you how to work with your muscles directly, perhaps with a wand or even with your fingers. When I feel my pelvic floor locking down, I go and grab my wand, drop trowel, lay on my bed, put my feet up on the wall, and I insert my wand in my vagina, and I'm looking very, very specifically for any muscles that are tight and painful to touch. And when I find them, I gently massage them. And so now I don't need to go see a physical therapist. And more importantly, I never let the pelvic floor tension get out of control because I know exactly what to do when I start to feel it. And that is, I use a wand internally. We have a ton of men and a ton of women who do internal therapy on their own. Super easy, super safe. Ask your physical therapist how to do it. Now, if your flare has lasted longer than a couple of days, or it does not seem to be responding, it's time to call your physical therapist. Get back to that physical therapist. Let's do another pelvic floor assessment. Let's make sure that nothing new has arisen, because again, these muscles are really easy to re-injure. And remember that pelvic floor physical therapy is by far the most effective treatment for IC, but it will take time and effort to restore normal muscle tone, especially in muscles that have been tight for years. Usually you do it once a week for 10 or 12 sessions and then reevaluate, but it's very, very common to have maintenance sessions. I mean, I've gone through 3 rounds now in the last 10 years of physical therapy, and it's just so interesting how you get the muscles healthy and then something happens, you have to work for a long period of time, and those muscles start to get tighter and tighter again. So it's not unusual to go back to a physical therapist and ask for a little bit more help. Now, the question that you need to ask a physical therapist is, are my muscles responding to physical therapy, or are they always locking back down into tension? If your muscles are always locking back down into tension, like mine is on my left side, then we have to ask why. We've got to take it a step further, look past muscle and look at bone. So in my case, it's my SI joint that is hyperflexible, that is keeping my muscles on my left pelvic floor very, very tight and dysfunctional. So if you're not responding to therapy, it's time to look at your hip, your SI, your tailbone, your knees, and maybe even your feet. Or what Dr. Jerome Wise, who has written this great book, Breaking Through Chronic Pelvic Pain, what he found in his clinic, because it became the mystery of his career to figure out, why do some patients always locking back down into tension? And the answer was in their feet and how their foot hit the ground. If you have an ankle that rolls in, ankles that roll out, if you're pigeon-toed, duck-footed, if you have a history of bunions, any other thing like that, all of those stresses when you walk get directed and reflected back up into your pelvis, where they can contribute to pelvic floor tension. So what he found in his clinic is often the last piece of their treatment puzzle was getting them to a podiatrist to improve how their foot hit the ground. Now, last but not least, some patients are really reluctant to have internal massage because they have a history of sexual abuse or rape. If that was you, number one, I'm so sorry. I'm so sorry that this happened to you. Tell your physical therapist. Your physical therapist will follow your direction. But you have to, and so your goal here is to build trust with that physical therapist. You don't have to have internal work right away. You can do external work for several weeks, even several months, until you get to the point where you can see the benefit of somebody working with those muscles. And hopefully at that point in time, you will let them do a little bit of internal work. I've had internal work done many, many times. It is the single most effective thing that has ever worked for me. No shame, no blame. It's not embarrassing. They do it all the time. You got to remember that the easiest way to reach these muscles is through the vaginal wall or the rectal wall. All right. I hope that helps. If you're looking for more information on physical therapy, come on over to our website. Take-home summary. The pelvic floor muscles are located inside of the pelvic cavity, where they sit along the base and sides. These muscles can be injured through trauma, impact sports, falls, sexual abuse, and childbirth. Walking abnormally can also cause long-term muscle dysfunction. Tight pelvic floor muscles can cause frequency, urgency, pressure, and pain. It may be difficult to urinate, have sex, or bowel movements. Flares occur when muscles become stressed or re-injured, often from falling, sitting for long periods of time, weightlifting, and sex. Flares are treated with relaxation, stretching, physical therapy, and muscle relaxants. Muscles that don't respond quickly may require, again, physical therapy. The best way to reach these muscles is through the vaginal or rectal wall. Internal physical therapy is usually required, often several sessions over time. Ask your therapist if your muscles are responding, or are they always locking back down into tension. If they are always tight, look at the hips, SI, tailbone, knees, and feet. And patients with a history of abuse or rape may be uncomfortable with therapy. Please tell the therapist without any shame. They need to earn your trust.
Suggested products from the ICN store. Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss is my all-time favorite book. Outstanding for anyone struggling with pelvic floor dysfunction, muscle and nerve injuries. If you're struggling with pain, you can't go wrong with When It Hurts Down There by Dr. Angie's Store, which is chock full of tips that will help you reduce your pain levels. Of course, our Ginger Bee microwavable heating pad is fabulous, fits perfectly over the pelvis. Our body heat heating pads you can wear for 8 hours. The Intimate Rose pelvic wand. And of course, PEA was found to reduce pain and urinary symptoms in a 2019 IC study. So look for the brands Peora and P-Leaf. The IC101 Guide for Managing IC Flares is our great resource for all types of flares out there. Of course, IC101 is not just a bladder disease. And for patients who are struggling, you can absolutely sign up for coaching sessions. We would love to work with you if you're struggling.